Hi, we are going to be talking about rheumatic fever today. Rheumatic fever is a condition that can inflame and make the hearts, joints, brain, and skin swell. According to the CDC, it is thought to be an immune response due to an earlier infection. Rheumatic fever is most commonly found in children ages 5 to 15 who have suffered from an untreated strep throat infection. And while rheumatic fever is rare, it has the potential to be life-threatening if it is not treated right away. Apart from strep throat, impetigo and scarlet fever are also infections that can cause rheumatic fever if left untreated. Rheumatic fever is not contagious, but the illnesses that lead to the infection can be spread around from others, possibly increasing the chances of getting rheumatic fever. Rheumatic fever is caused by a bacterium called Group A Streptococcus. This is the same agent that causes strep throat infections and scarlet fever, and because rheumatic fever stems from those prior infections, it is the same agent. And over here on the slide, this is an example of what that agent would look like underneath a microscope. Group A Streptococcus is a gram-positive cocci, and it has an incubation period of 2 to 5 days. It is most commonly found in the human noses, throats, and skin because that is the primary reservoir for this infection. And it is also easily preventable just by hand hygiene, avoiding sharing things like food, drinks, utensils, cleaning and disinfecting stuff you would touch on a daily basis, like doorknobs perhaps, and staying home when you are sick, especially with strep throat. The symptoms of rheumatic fever stem from the inflamed organs the illness causes. Signs and symptoms can include fever, painful joints, most often in the knees, ankles, elbows, and wrists, swollen joints in those same areas, chest pain, fatigue, a painless rash, uncontrollable body movements, which is also called chorea, crying or laughing at inappropriate times, this is unusual behavior, painless bumps under the skin, and even a possible heart murmur. These symptoms may be few in some individuals, while others have several of them, and they can change throughout the disease. After a strep throat infection, it usually takes 2 to 4 weeks for rheumatic fever to even start. There are certain settings where strep throat can spread easily, thus having a higher chance of rheumatic fever occurring if it is not treated properly. Places like schools, daycares, and military training facilities. Schools and daycares is filled with children, which is what rheumatic fever is most commonly found in, and there are so many of them and so close together. So it's very common for daycares to have an outburst of strep throat. And when rheumatic fever is found in adults, it is most commonly found in military training facilities because of that crowding. It is also common for someone who has had rheumatic fever in the past to get it again if they get another strep throat or scarlet fever infection. As stated before, if not treated promptly, rheumatic fever can become life-threatening, but it can also cause long-term heart damage. According to the CDC, this usually occurs decades after the original illness, but if severe enough, rheumatic heart disease can start right away. Rheumatic fever weakens the valves between the chambers of the heart, and if severe enough, a person can acquire rheumatic heart disease, which would need heart surgery and could potentially lead to death. Over here, we have a picture of what those valves look like in the heart, so you can see they're pretty corroded and weakened. There's no single test used to diagnose rheumatic fever. Instead, doctors look for the signs of the illness at the medical history, and they perform certain tests to test for the prior infections. These tests would include a throat swab, which would test for strep throat. They would do a blood test to test for the antibodies for strep, an EKG to show how well the heart is functioning, and an echo, which according to the CDC is like a movie of the heart. And over here on this slide is criteria that some doctors use for rheumatic fever. It is called the Jones criteria, and this is like an older version of it where it's longer. So they just use this criteria and look for all the symptoms it points out, like joint involvement, myocarditis, erythema, that kind of stuff. Rheumatic fever is treated with a combination that usually goes as followed: treatment for strep, anti-inflammatory medicine, and bed rest. The first step is to treat the strep infection with antibiotics like penicillin, which would kill the bacteria and ease the symptoms. Next, they would treat the inflammation with an anti-inflammatory like naproxen, which would reduce the inflammation, fever, and pain. And lastly, they would have to go on bed rest, which can range from 2 to 12 weeks. In some cases, because rheumatic fever is most commonly found in children, children who have rheumatic fever may have to go on monthly antibiotic injections just to prevent it from happening again because strep throat is a very common illness in children. Some facts about rheumatic fever. Rheumatic fever is most common in areas like Africa and Asia because there are no doctors there to treat the original strep infection that caused rheumatic fever. Australia has the highest number of cases with 59 per 100,000 people, while other areas like the US, for instance, only has 1 to 100,000 people. There is a movement called the Rheumatic Heart Disease Action that is intent on ending rheumatic fever. They raise awareness of diagnosing strep infections and have even reached refugee camps to help out. Overall, rheumatic fever may be rare, but it is a very serious illness that is easily preventable by treating prior infections. There are many dangerous symptoms, and it can take up to 12 weeks to fully heal a child from rheumatic fever. As said before, antibiotics, anti-inflammatory, and bed rest are the best way to heal from this disease, but preventing it is the greatest way. Thank you.